Okay, welcome back again, guys. So in the last class, we actually looked at a very key important introduction to the upper limb. We said this whole aspect is the upper limb. We listed the bones present in the upper limb along with all their structural subdivisions, subregions. We listed all those. And today, looking at each bones, stating few characteristics about them and what we tend to know about all these bones. So, the first one we'll be looking at is the clavicle, and I've done justice by using this app, Human Anatomy at Lax. It's a very good app. Although I'm using the how will I say the free trial one, so I don't have full access, but at least the one I do have for now, until I get the full one, it's well detailed and well explanatory for students to understand the pictorial view of the whole body, apart from just having let me say formal kind of assimilating knowledge about the whole stuff, not just cramming or putting it off head, but also having a clear knowledge of human body so that in any case, in any scenario you find yourself, maybe in terms of emergency cases in which you find the maybe a person with a dislocated arm, probably the person cannot move, and you sense rather the problem could be that okay, the arm is not well properly connected or communicating with the axial skeleton. So what do you do? What are the cases syndromes? What are the things that just happen? So the essence of the pictorial view is just to give you a foreknowledge of what could actually be the problem. So in this case, here we are looking at the upper limb. I've faded all other skeletons, so we are primarily looking at the clavicle. So looking at the clavicle from the superior view, we see the clavicle is a kind of S shaped elongated bone. We see it has double curved. It's double curved. That is a curve at this side and also a curve at this other point. So also, looking at the anterior view, you can also deduct from here that the clavicle is connecting the axial skeleton with the upper limb, and it has two joints. When we say two joints, two point of articulation. First point of articulation is with the axial skeleton, while the second point of articulation is with the scapula at the back. We'll get to scapula very soon. In case you're wondering where is the scapula, we'll show all those very soon and you'll have a clear understanding, a clear knowledge of everything. So let's just have a few notes about this. So the clavicle makes up the anterior portion of the shoulder girdle. You want to ask what the shoulder girdle? The shoulder girdle is the joint around here, the shoulder joint. So it makes the anterior portion, the one facing the front. We are looking at on the body with this anterior portion. Okay. So the part of this appendicular skeleton that connect the upper limb with the axial skeleton. So this is the appendicular skeleton. So this part of the appendicular skeleton connects the whole upper limb with the axial skeleton. And the clavicle is a long and double curved bone. That is, it has a curve here, also has a curve around here. So it has curves at two places and articulates medially. So when we talk about media and an horizontal position, for medial position, we have always have a midline that cut across the whole body in this format. So the midline format that cuts across the whole body in this format is called the median. So anything close to the midline is the median, while anything far away from the midline is the lateral. So the medial part of the clavicle, that is mean medial one, the part closer to the midline, articulates with the cartilage of the first rib. That it articulates with the cartilage of the first rib. Okay, so let's have something here. Let's do something very quick here. I want to show others. Okay, okay, show. Okay, show. Okay, sorry. Okay, show. So, so this is the first wave. So, okay. So, medially with the cartilage of first rib and the mandible of the sternum. So, this structure here is this structure here is the sternum. This structure here is known as the sternum. The one I just highlighted in blue is known as the sternum, and the mandible of the sternum. This is the mandible of the sternum. So, the clavicle articulates with the mandible of the sternum, which is this. Medially articulate with the mandible of the sternum, which is this, and also with the cartilage of the first rib. The cartilage of the first rib it articulates with it, and it forms something called the sternoclavicular joint. It forms a joint called the sternoclavicular joint. While on the other hand, on the lateral aspect, the acromion of the scapula, the acromion of the scapula, the acromion head of the clavicle articulate with the acromion of the scapula to form something called the acromioclavicular joint. So the clavicle has a S-shaped surface, and the surface is flat and rough and provide attachment for deltoid muscles. We have a muscle called the deltoid muscle, which is at the region of hair. So it provides a attachment for the region of for that muscle. That superior we have the superior surface. We provide attachment for the muscles at that region, and also the trapezoid posteriorly provide attachment at for the muscles anteriorly, and also for muscles trapezoid muscle in the posterior aspect of it. So medially, there is a narrow area for the attachment of pectoralis major. So in the medial side of this place, muscles that are attached to it, we have a muscle called the pectoralis major, and the superior border provides attachment for the sternocleidomastoid. We have a bone called sternocleidomastoid which connects from that region to the mouth, and it helps in mastication, that is helps in the movement of the mouth. So the clavicle serve as a point of attachment for these key muscles that I just mentioned, sternocleidomastoid, pectoralis major, which is attached to the medial aspect of the clavicle, also the deltoid which are attached to the anterior aspect of the clavicle, and also the trapezius muscle which are attached to the posterior aspect of the clavicle. And so also when we look at the inferior view of the clavicle, look at the inferior view of the clavicle. The clavicle at the inferior view has some grooves, some specialized grooves that gives attachment for muscles like the trapezoid muscles or trapezius muscles, which has just been stated there, and also provides has a groove which provide attachment for subclavius muscle and so on and so forth. So we stated the clear importance and clear function of the clavicle. So in the next class, we look at the next bone which comes up very soon, and that is the scapula.